Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about why do you feel weakness in your muscles of your legs after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button if you don't subscribe already so you can catch all of our latest videos related to knee replacement surgery, frequently asked questions, exercise, rehab recovery, and much, much more. So, muscle weakness, probably I would say 100% of individuals after knee replacement surgery are going to have weakness. And particularly we're talking about the muscles surrounding the knee and the muscles that cross the knee joint. So probably the stereotypical one that you hear about and the one that's studied the most often and looked at the most often is your quadricep muscles. And those are the big four muscles of your thigh. Their work to extend the knee and of course to stabilize the knee and function in all sorts of daily activities, walking, going up and down stairs, getting up from a chair, you name it, your quadricep muscles are probably working. But there's also most likely weakness in other muscles in the legs and surrounding the knee, such as your hamstrings in the back of your thigh, your calf muscles particularly. So why do we feel this weakness and why do we have decreased force that we can produce from our muscles and decreased ability to contract our muscles after having a knee replacement? Well, there's different things that are inhibiting the ability to contract the muscles fully. So one of them is pain. Pain can really inhibit muscle contraction. You're just have that sensitivity. You don't feel like squeezing and tightening those muscles as much as you normally would. Also, swelling and inflammation is a big inhibitor of muscle contraction and muscle force production. So of course, those things are going to be pretty significant after having surgery. You're going to have a lot of pain, you're going to have a lot of swelling and inflammation. Hopefully you're managing both those things effectively, but they're still going to be there. They're still going to be part of the process of your recovery, especially early on. Other things to think about is your leg's just going to feel heavier. When you have that swelling, that fluid, you have new metal and plastic components in your knee, that's going to feel a lot heavier than what you're used to feeling in your leg and in your knee joint. So it's going to feel heavier and you have decreased force production because the muscles are inhibited. What else you have working against you is just fatigue. You're going to be tired. Your body is working hard, working overtime. It just went through the trauma of a knee replacement surgery. And for anyone who's, you've looked at those YouTube videos of, what a knee replacement surgery entails, it's pretty intensive and there's a lot that's going on and a lot that your body is going through. So you're going to be fatigued, you're going to be tired, and you're going to be recovering. You may feel drowsy and sedated because of the surgery, but also because of medications, because of the wearing off of the analgesia, analgesics that you were on during the surgery or after. You're probably not sleeping very well. So just all that together, you're feeling drowsy, tired, fatigued in general, especially early on after surgery. And something else to think about is you're probably not as mobile. You're probably, hopefully you're doing some physical therapy, hopefully you're doing some exercises, getting up and walking, but most of your day is probably resting and recovery. It's laying on the couch, it's laying in bed, wherever is comfortable, and you're probably not doing as much as you normally would. Something that's also really common, really prevalent, especially with our older population, is malnutrition after surgery, before or after surgery. So not getting adequate nutrients, getting that protein that you need to build up that muscle strength after your surgery. So all of those things combined, so again, inhibited muscles from pain and swelling, the leg feels heavier because of that swelling and because of the new metal components, you're fatigued, you're tired from the trauma of surgery, and you're just not moving as much after surgery as you recover, and you're losing some of that strength and endurance. All those things together are going to play a big role. But we also want to think about before surgery. Before surgery, you probably had chronic knee pain and debilitating knee pain, which means you probably weren't tolerating activities, tolerating exercises, walking as much as you normally would. You probably were relatively sedentary compared to how you were before that time. And over time, that's going to lead to some weakness, some decreased activity tolerance. So all those things together, we're trying to build back that strength, build back that endurance, build back that function. After surgery, it's going to take time, it's going to take physical therapy, it's going to take eating a healthy diet and getting enough protein in your diet. It's going to take rest and recovery and make sure you're doing your best to get some sleep. I know it's difficult, but it's going to take time. And everyone has weakness after surgery, and it can be persistent. So it takes weeks, it takes months to really build that strength back up to where it was and where we want it to be. I hope you found this helpful. I hope this helped answer any questions you may have. Please, again, be sure to hit that like button to help spread this video to other viewers and help support our channel. Please leave your comments and questions below, as that helps spread this video to other individuals and helps me interact with you and help answer any questions you may have. Thank you very much for watching.